Hi, my name is Karyed Moreno, and I am an undocumented graduate student currently attending Grand Canyon University. I also attended Grand Canyon for my undergraduate program, but I am currently doing the Masters of Public Administration with an emphasis in healthcare management. I migrated to the United States when I was 12 years old on a promised Disneyland vacation, and I have not returned since. I heard about your organization from a previous recipient and would be honored to be considered for this great opportunity. One of the numerous challenges that I currently face in my graduate program is not only being a first-generation college student, but being a Latina, as I do attend a private Christian university. Therefore, there are only a few of us, which can be a cultural challenge. Another crucial aspect and challenge of it is finding funding for it, just because it is a tough battle for an undocumented student to complete their undergraduate degree, but it is even more difficult and almost unheard of for us to go to graduate school just because the sources are limited for us. Therefore, that can be a challenge. Just focusing on how to fund my education and continue on. Another challenge is that there are no breaks in my program. A class ends on a Wednesday, and the next day on Thursday, the next class begins. There is only a 2-week winter break once a year, so that can be a little tough at times, just because one can or has to try to balance life with volunteering, work, and school. So that can be a challenge. Therefore, I do try to take advantage of the 2-week break as much as I can. I hope to continue on with my program to give back to my community. I have worked with the Wesley Health Center as a volunteer in translating for their patients. Wesley offers a program in which low-income families can receive medical services at a more affordable rate. But one of the barriers is that many times the doctors and staff don't speak Spanish. Um, Therefore, I have even seen children translate for their parents, which can be a bit heartbreaking, as that does take away from their innocence and their childhood as they're trying to explain to their parents what it is the doctor is trying to tell them. And it is one thing to speak fluent Spanish, but it is a completely different thing to try to explain medical terminology. Therefore, I hope to assist in breaking that barrier with my program and hopefully manage a clinic such as Wesley's, and also market such services out to the community and inform them that they are available, as many of us Latinos don't know of such services, even though we're one of the most rapidly growing in the country. We are also the group that less or doesn't seek medical services as much. A prime example of that is my husband, who is an educated man, attended Arizona State University. However, he had not been to the doctor in 20 years, and now that he finally went, he sees the importance of it. I am a strong believer in preventative care, and I think that we can treat illnesses and get to the root of the problem before it is too late, which can many times even save lives. And I think that that can be a great thing for communities, and we can change that in the generations to come. And I would hope and wish to be a part of that change. I would like to thank you for taking the time to consider me as an applicant, and I look forward to hearing from you. Have a great day.